Okay, we're going to pick back up. I believe the video shut off on us a little bit, but we were on the dorsal side and we were looking at those muscles along this side. I did a fancy little trick with my hemostats here. I cut a little bit of this skin to pull this back so I could see a little bit better. And I take my hemostats. I don't want to keep holding that skin, right? So I can use my hemostats to hold that back for me while I then have my hands free. If you don't have hemostats, it's okay. It's not going to be the end of the world. And it doesn't always work that well, too. So now we're looking at a few different muscles. You can see I actually jumped ahead a little bit because I didn't realize the video stopped recording. Towards the bottom here, we still see my gracilis minor that we saved. And sitting on the posterior side, this bigger muscle, anterior to gracilis minor, but posterior to the rest of the thigh region on the dorsal side. This is going to be semimembranosus. Semimembranosus. Now, I've already cut through this section here when the video stopped. It's actually a fairly easy section to cut through because towards the top here, there's a lot of loose fascia that makes it real easy to cut down through. You'll notice that there's another muscle anterior to semimembranosus. There's another little pocketing of fascia. And then there's another smaller muscle all the way on the very top of the thigh region. This muscle, the second most anterior one, so here we had semimembranosus. This one is gluteus maximus. Gluteus maximus, homologous to my gluteus muscles within felis. And then all the way on the front here, the smaller one, this is tensor fascia lata. Tensor fascia lata, pretty small. If I make this cut, and let's free up semimembranosus like we've done before. When I was doing this, and this is where the video shut off, I was cutting this way, and that feels a little unnatural because I'm right-handed. So feel free to manipulate your frog. Make it comfortable for you so that you can make these cuts. Go real slow, be real gentle. You'll notice there's this muscle towards the back end here. We're not going to be learning this muscle. It's not homologous to anything in felis. Here's semimembranosus. As I pull it away from the rest of the thigh, I'll notice there's a lot more fascia in there. I might even need my scissors to cut through some of that. And we'll go real gentle like. Remember, you can pause this video at any time, so don't feel, if you're not going as fast as me, that's fine. Pause the video. One of the things we can do now, we can flip this frog so you're looking at the posterior side of the thigh. I'm going to take my forceps. Actually, I'll take my scissors. I'm going to free up this posterior side like we've been doing. Real slow, real careful like. Just cutting through the fascia. I'm not going deep to the muscle. And I'll use my forceps to free it a little bit more. fascia that might lie below. All right, now what I want to do, I'm going to take my forceps and lift up This is a little bit more difficult one, so let me try to help you out here a little. I'm looking at the posterior side. I'm trying to just get between the semimembranosus and the muscle that's below it. When you start going through muscle fibers, you'll know. And I want to be able to do this. See how my forceps are out on the other side of it now? Once I have done that, I can go back to this other view. Now down into that thigh region. Clean it up a little. But what you're going to notice is there's a muscle that's below my forceps. Here's semimembranosus. Deep in there is another muscle. That muscle that's on this side of my forceps is semitendinosus. Semitendinosus is deep to semimembranosus. All right, if I really wanted to, take my scissors, leaving my forceps in like that. And just follow my forceps. I can cut through semimembranosus, and I get a really good view of semitendinosus sitting below. Remember this muscle, we're not learning this muscle. This muscle down here, this was gracilis. If I look deep, real deep in there, I'm looking at my adductor magnus. Let's go back up to the top here. And we'll see gluteus maximus here. And remember up here was tensor fascia. Tensor fascia, it's real small. Gluteus maximus. You don't have to do this. I can free up tensor fascia a little bit from gluteus maximus. Just to show you that we have two muscles there. If we look towards the top, we're looking down now on the anterior side of the thigh. Here's gluteus maximus. There's a line. You can see where it stops. It's a big muscle here. Remember, sartorius is right here. This big muscle, big muscle. This is basically like the quadriceps of the frog. This is going to be my triceps femoris. Triceps femoris. This is taking the place of biceps femoris. Obviously, instead of having two branches, it has three. Hence the name triceps femoris. Okay? So that does it for the hind limb. We have sartorius, adductor magnus, adductor longus, gracilis major and minor, triceps femoris, gluteus maximus, adductor longus, tensor fascia lata, semimembranosus, semitendinosus, I believe I said adductor longus twice. But there you go. That's the muscles that I want you to see on the frog there. All right, the next thing I want you to do, I'm going to zoom you back out a bit. We're now going to take our forceps. I'm going to lift this up. I'm going to cut towards the body. You have to go through some membrane there, right around the joint of the thigh and the abdominal cavity. There's a nice membrane that you have to just kind of go through. It's right here. And I want you to cut through the skin, it's very loose here, up the abdominal cavity of my frog. Once you get towards the thoracic region, and this wouldn't be really the thoracic region, it's more or less just a big trunk. There's no diaphragm in a frog to divide those two regions up. But as you get towards this head region, you're going to start to notice a lot more fascia holding the skin to the body. So just go real slow. Make sure you're just cutting the skin. When you see that fascia running off to the side, you can free things up a little bit. And I don't want you to go onto the chin. I want you to go to basically the end of the sternum. All right. Once you get there, you can take this other side, and you're going to cut down the skin on the opposite side so that you're basically opening up the skin like the pages of a book. Going real slow. I'm lifting that skin so I can see where that connective tissue is. Once I get to the end of the sternum there, I'm going to go sideways. So once again, pages of a book. Going out to the lateral side. Taking that skin from the muscle by slowly clipping through that connective tissue. And then you can, if your limb is down like this one, I can just fold it underneath the limb. I can take this side, my other side, other lateral side. I can free that side up as well. If you have the hemostats, you can use those. Do not cut the skin off. Do not cut the skin from the body. What we're going to do in the end is we're going to, like I did with my hind limb, I put the skin back over top because it'll keep everything moist. You don't want anything drying out. So there's a few things I wanted to point out here. You'll see, looks like frog's got some abs. This is rectus abdominis. We didn't learn the oblique muscles, but you would have your external obliques, rectus abdominis, running down the middle. They would be homologous to the cat as well. In the middle here, it's going to be hard to see because there's this connective tissue over top of everything. So I'll take scissors, my forceps, I'll take this connective tissue off. Be careful if you do remove something, piece of tissue, keep it in the Ziploc bag with your frog. All right? Keep it in the Ziploc bag with your frog. I'll give you an option of how to dispose of the waste in the end, at the end of the semester. So now you're seeing this clear division between my external obliques and this triangular muscle here. This triangular muscle goes up